The antibiotic overprescription crisis debate, 1990s present, global. In the late 1990s, a storm was quietly brewing inside hospitals, clinics, and doctors' offices around the world. At first, it seemed like a simple issue. Antibiotics, those life-saving drugs, were prescribed by doctors to treat infections. But little did they know, their overuse was setting the stage for a crisis that would impact generations to come. The question was clear: who was to blame? Was it the doctors, handing out prescriptions like candy at the first sign of a sniffle? Or was it the patients, demanding quick fixes for every cough, every cold, every fever? Or perhaps the policymakers, who failed to put stronger regulations in place to curb the unnecessary use of antibiotics? The mystery deepened as hospitals across the globe started to see a troubling pattern. Superbugs, bacteria resistant to the very antibiotics that were supposed to eliminate them, were emerging. These were bacteria that no longer feared the drugs that once brought them to their knees. And the more antibiotics were used, the stronger these superbugs grew. It was like watching an unstoppable force gaining momentum, yet no one could stop it. The debate escalated. Doctors argued that they were simply trying to help their patients, prescribing what they thought was needed to relieve symptoms quickly. Patients, often frustrated and impatient, pushed for antibiotics when they felt unwell, believing they were the only way to feel better. Meanwhile, policymakers struggled to keep up, caught between the pressures of the pharmaceutical industry, healthcare providers, and public demand for quick solutions. And as the years passed, the stakes grew higher. Hospitals saw more cases of infections that couldn't be treated with any existing antibiotics. People died from infections that once would have been easily treatable. The world was on the brink of a new kind of medical crisis, one where even the simplest infection could turn deadly. In the end, the responsibility for the antibiotic overprescription crisis was shared, a delicate web of doctors, patients, and policymakers each playing a role. But the question still remains: can we reverse the damage done? Can we turn the tide before it's too late? If this story resonated with you, please like, share, and subscribe, and leave a comment below. Your support helps the channel grow.